Hi, I'm Dr. Braha. I'm a board-certified gastroenterologist here in Brooklyn, New York. Today, we're here from ZerMed to talk about colonoscopy and colorectal cancer screening. Early detection is the key to colon cancer. By finding cancers early, we can often cure them, especially with colon cancer, where we can prevent colon cancer by removing polyps. These are small growths that we can find during a colonoscopy in the colon. By removing them, we can prevent the development of colon cancer. So today we're here, instead of in the studio, at Brooklyn Gastroenterology and Endoscopy Associates, here in the Sheepshead Bay section of Brooklyn on Emmons Avenue. We're here today in the surgical center where we have patients who have come for screening and surveillance colonoscopies. If you're watching today and you're 45 years old or older, you are eligible for a screening colonoscopy. This is where we take a small camera while you're sleeping, place it into the rectum, and go through the entire colon looking for colon polyps. We don't feel colon polyps, and oftentimes we don't even feel or know that we may have a colon cancer. So early detection and prevention is the key to preventing colon cancer and curing colon cancer. You will see today colonoscopies where we go looking through the colon and find such conditions such as hemorrhoids or diverticulosis and colon polyps. We find these in 30 to 40% of patients and can remove them during a colonoscopy. As I said, the procedure is painless and takes about 15 minutes. So if you're over the age of 45, if you have a family history of colon cancer, if you have any symptoms that might be associated with colon cancer or other significant colon diseases, such as Crohn's disease or colitis, we want you to go see your provider, your primary care physician, your doctor, and ask them if you're eligible for a colonoscopy. Some alarm features that we want to look out for that would prompt us to do a colonoscopy at any age would include bleeding, red blood in the stool, red blood noted in the bowl or when you wipe, black or dark stool, diarrhea that doesn't go away after maybe a week or two, and also weight loss or abdominal pain that goes unexplained. If you have any of these, please go and see your primary care physician to determine whether or not you are eligible for a colonoscopy. But anyone watching today over the age of 45 should be screened for colon cancer. So thank you for watching, and I hope you will learn from our procedures today where we go and perform colonoscopies on our patients, searching for colon polyps and for colon cancer. So thank you for watching. I hope you've learned a bit about colon polyps, colon cancer, and colonoscopy. Now let's get up and go into the surgical center where we're going to start performing colonoscopies today on our patients. And I hope you enjoy the show and that you're able to learn from our program here at ZerMed. Thank you for watching. Let's go. Hi, I'm Dr. Braha from ZerMed. Today we are doing a colonoscopy where we take a small flexible camera and insert it into the colon. Colonoscopy is used for many reasons and to help diagnose or treat many diseases. But starting at age 45, all of us are supposed to get screened for colon cancer. Colon cancer occurs in about 5% of patients and often starts off as a small polyp, a little growth inside the colon. Starting at age 45, we perform colonoscopies to search for these small polyps. Most patients will not feel these polyps, and that's why it's called a screening procedure. It's done on patients who are healthy, who feel well, starting at age 45. The chance of having a polyp is about 30% in our practice. We're looking here at the beginning portion of the colon, and right there is something called the appendiceal orifice. That's where our appendix is. Once we see this area, we know we've reached the beginning portion of the colon, and we start to slowly remove the camera in search of polyps. As we come a bit higher up here in the colon, we enter the ascending colon, which is along the right side of the abdomen. The colon ascends up towards our chest and then makes a turn across our abdomen. So we carefully pull the camera backwards, searching in all the areas of the colon, looking for polyps. Compass to the left or right? Stefan, where's the pump?
goes to...
The pump is my right or left?
Okay.
To the left. Okay. Here we are in the colon. We have found a small polyp here at the 1 or 2 o'clock area right there, this little bump. That's a polyp. And we're going to remove this. There are a few ways to remove polyps. There are forceps that we can use to snip away at the polyp, or snares that we can use to grab and remove or burn out the polyps. Open. Close. Got it. Cut through it. Open. Close. Up. Take that. Transverse. Plus. Yeah, suction of
colon surgeon. For what?
Maybe diverticulitis. Anyway. Yeah, you can check now.
Yeah.
You got it? Great. You can take. Okay.
Nice short time. 9:07 in the room. What time is it?
We have one bottle so far, right? There was only one. Yeah. I think I saw something on the way in.
Like 15, 25, 30.
Yeah, it looks like it's biopsyable, that little one in the rectal node, so. Alright. Biopsy. Biopsy. A little something right there. Little teeny polyp, and that's. Oftentimes these are called hyperplastic polyps, which don't in general cause cancer, but we sample them to be sure they're not dangerous polyps. Got a little polyp here in the rectum. That's what we saw when we came in. Let me see if I can get this in the forward viewing position. There it is, right? That's the one we saw on the way in. Okay. We're going to take out this polyp with a forceps, which we place through the channel of the camera, through the colonoscope, open it, and then what we do is we position it right over the polyp, close, and we're able to snip this little teeny polyp out, which measures about a millimeter, 1 to 2 little millimeters here. And these are small polyps. Over time they can grow and develop into a colon cancer. And this is the whole point of doing a colonoscopy. You have a patient who has no symptoms, feels well, but you find these small polyps and we remove them to help prevent the development of colon cancer. And so this concludes this patient's colonoscopy.